Hey everyone, I'm Dr. Karr, and I'm here to help you make smarter choices to live a healthier life. So let's say you went to your doctor and got your labs checked. And one of the labs, they checked your cholesterol and they tell you that your LDL is high and they want to prescribe you a statin. The question is, do you actually need to be on a statin medication? Statins are some of the most prescribed drugs in the world, and they do work for some people. But over the years, their use has expanded far beyond the people who truly benefit the most. Today, we're going to break down exactly how statins work, who they actually help, and whether following cholesterol numbers really is the best way to approach your health. First, let's talk about how statins actually work. Your liver is like a factory that produces cholesterol, which your body uses for cell membranes, hormones, and other essential functions. LDL, the so-called bad cholesterol, is one of the main ways cholesterol gets transported through your bloodstream. Now, when you take a statin, it turns down an enzyme called HMG-CoA reductase. But here's where it gets interesting. Because your body still needs cholesterol, the liver starts pulling it from the bloodstream instead. It does this by increasing the number of LDL receptors, which kind of act like loading docks that grab LDL particles and bring them into the liver. So statins lower LDL in two ways: by reducing production and by forcing the liver to scavenge more LDL from the blood. That's the biological mechanism, but that's only part of the story. Now that you know how statins work, let's talk about how their use has changed over time, because this is where it gets really interesting. When statins were first introduced, they were given mostly to people who had a heart attack. And these high-risk patients, the benefit was clear. The number needed to treat, or NNT, meaning the number of people needed to take the drug for one person to show benefit, was around 25 to 30. That means for every 25 to 30 people that took a statin, one heart attack was prevented. Pretty good odds, right? But then something happened. Statins started being prescribed to low-risk patients. Instead of just using them for people with a history of heart attack, doctors started prescribing them based upon LDL levels alone. And here's the problem. The NNT shot up to 400 or more in low-risk patients. That means you'd have to give statins to over 400 people to prevent just one heart attack. It's like airbags in cars. At first, they were only deployed in serious crashes, saving lives. But now imagine they deploy anytime you get in a fender bender or tap your brakes. Sure, a handful of people may still benefit, but for most it's unnecessary and sometimes even harmful. And the real problem is we've become obsessed with LDL, even though LDL alone doesn't predict heart disease. For example, imagine you have two patients. So patient A has a high LDL, low total inflammation, great metabolic health, and a 0 coronary calcium score. Patient 2 has normal LDL, but high insulin resistance, inflammation, and arterial plaque. Which one of these two people is actually at risk for a heart attack? It's not the one with the high LDL. It's the one with the underlying inflammation and metabolic dysfunction. That's why doctors shouldn't just look at LDL. They should be checking things like inflammation markers, coronary calcium scores, and metabolic health. So if you're on the fence about taking a statin, you need to consider not just the potential benefits, but the risks, because statins are not neutral. One of the most common complaints is muscle pain, weakness, or cramping. That's because statins interfere with coenzyme Q10 or CoQ10, which your muscles need for energy production. Over time, this can lead to chronic fatigue and difficulty recovering from workouts. Additionally, some patients report memory problems, difficulty concentrating, and brain fog while taking statins. The FDA actually even issued a notice about this. While not everyone experiences it, the fact that cholesterol plays such a critical role in brain function and neuron health makes this a real concern. Statins can also raise liver enzymes, which in some cases may indicate liver damage. They also increase insulin resistance, which is why long-term statin use has been linked to increased risk of type 2 diabetes, especially in people who are already at risk. Another big side effect of statins that often doesn't get enough attention is its impact on your production of hormones. Cholesterol is the building block of steroid hormones, including testosterone, estrogen, progesterone, and cortisol. When you aggressively lower cholesterol, you're also lowering your body's ability to produce these critical hormones. This is why some people on statins report low libido, fatigue, mood swings, and even muscle loss. If your doctor is putting you on a statin, but not checking your hormone levels or metabolic health, they're missing a huge piece of the puzzle. So before blindly following an LDL number, here's what I recommend you ask your doctor before starting a statin. 1, do I actually have arterial plaque? A coronary artery calcium or CAC score can tell you if you actually have plaque buildup. If your score is 0, your heart disease risk is likely low, no matter what your LDL level is. Next, what's your ApoB level? ApoB is a far better measure of how many LDL particles are actually circulating in your bloodstream. If your ApoB level is normal, your risk of cardiovascular disease is much lower than what an LDL test alone would suggest. Thirdly, you'd want to know if you have inflammation. So chronic inflammation plays a huge role in heart disease, and a simple high-sensitivity C-reactive protein or hs-CRP test can measure this. If your hs-CRP is high, that's a sign that your risk might be elevated even when your LDL is normal. And fourth, what's your metabolic health? Insulin resistance, high triglycerides, and poor metabolic function contribute far more to heart disease than LDL alone. Checking fasting insulin, triglycerides, and an HbA1c can give you a much better sense of your actual risk. Now, you may be wondering, why aren't doctors routinely ordering these better tests? Why does everything seem to revolve around LDL? And the answer is because the healthcare system is built on outdated guidelines that reward statin prescriptions more than real risk assessment. Doctors and hospitals are graded on how many of their patients are on statins, not on whether their patients actually benefit. Some insurance plans even offer financial incentives to doctors to prescribe more statins purely based on LDL numbers. And here's the crazy part. Many of the most accurate tests for heart disease risk, like ApoB, Lp(a), and coronary calcium scores, aren't covered by most insurance plans. Why? Because it's cheaper and easier just to prescribe a statin than to actually assess someone's full cardiovascular risk. And here's what frustrates so many people about modern medicine. Instead of actually evaluating an individual's real risk factors, most doctors follow a paint-by-numbers approach. If LDL is high, prescribe a statin. If it's low, you're fine. But that's simply not how heart disease works. So here's the bottom line. Statins can absolutely be beneficial for the right person. If you've already had a heart attack, if you have confirmed arterial plaque, if you have high ApoB and high inflammation, then yes, statins could be a great tool for reducing your risk. On the other hand, if your doctor just wants to put you on a statin because your LDL is high, you need to ask some more questions. What's my actual heart disease risk? Do I have plaque? What are my inflammation levels? Because if you're low risk, you could be signing up for a lifetime of medication with all the side effects for little to no benefit. Thank you again. My name is Dr. Karr. I'm here to help you make smarter choices to live a healthier life. I hope you appreciate the content. If you have any questions, you can leave them in the comments section. And as always, make sure to hit like and subscribe. Thank you.